I'm Tony Bevilacqua. I'm an orthopedic surgeon at Sports Medicine and Orthopaedic Center. I'm here to talk about unicompartmental knee replacements, or what we call unis. It's a procedure that is not new in any way. The newness of it is that the procedure is now available to be done as an outpatient in some patients who qualify, and the technology for the operation has improved dramatically over the course of the 40 or 50 years that it's been around. The benefits for the patient, well, it changes their alignment. It fixes their alignment if that's a problem. It's outpatient if they're healthy enough to have an outpatient surgery. It doesn't, we don't do anything. We don't cut any ligaments, any tendons, anything critical. All of those are retained. They're essential for the proper function of the uni knee. So many people don't like the idea of a total knee because they know it'll feel artificial. This shouldn't have that artificial feel because you have your own ligaments, and that's all retained. All we're really doing is changing from worn out cartilage and bone to metal and plastic that replaces those exact spots and only those spots. Figuring out who is a candidate and who isn't is really just a matter of a visit or two in the doctor's office and looking at the x-rays and listening to the story and then examining the knee and see how does it examine, is there looseness to it, etc.
It hurt sleeping at night, it hurt walking, it hurt any type of really lateral movement to the leg, it really pain. He took some x-rays and he did his thing with twisting and turning and checking and seeing, and right then he told me, he says, you're a perfect candidate. I said, perfect for what? And he said, the uni knee. Well, I had no idea what a uni knee was. So he said, but we're not going to go there yet. He said, we're going to try several different processes first to see, and that may help, may get you through it.
For me, I'm always excited when I find somebody who actually only does have unicompartmental arthritis, because I know that ahead of them is a quicker recovery than the people that need the total knee.
Next thing I know, there's waking up in the recovery room, and soon after that, I think that was about 11:30 I woke up, and at 1:30 that day I was walking into my house, which kind of amazed me. Now, I did have a splint on, but still I was able to, felt fine, walked in the house. And at 3:30 that afternoon, the home nurse and the home therapist arrived. They said, okay, let's start therapy. And I was saying, yeah, wow. I mean, just a couple hours ago, I was under the knife, and now you want to start therapy? They said, yep, the sooner the better.
The other nice thing about doing it outpatient, especially in this day's economy, is that it's less expensive for the patient to do outpatient surgery. So anything that cuts down the expenses makes sense to me if you're going to have the same outcome.
The pain that I had before is no longer there. In fact, day one, the pain was not there. And where I'm at today versus where I was before, you know, I just can't thank Dr. Bev and the staff enough. You know, the quality of life that's improved for me.